All right, and we should be live. Hi, everyone, and welcome back to another session with Dental Shadowers. Today, we're joined by Dr. Patel, who will be talking about general dentistry. Doctor, thanks so much for taking the time out of your busy schedule to connect with us.
For sure. Thanks for
Please,
having me.
yeah, please feel free to take it away whenever you're ready.
Okay, let me start. Well, thanks for having me, guys. This is my first shadowing session online, so bear with me because obviously I don't know how to change the screen. So let me tell you guys a little bit about myself. I am a general dentist practicing in Chicago. I graduated from Rutgers School of Dental Medicine in 2014. I did a year of GPR at Hackensack University Medical Center. And I know a lot of your audience are people thinking about dentistry and going to dental school. So let me tell you my journey. It wasn't direct, it wasn't straightforward. So hopefully that you guys can find some inspiration to that. So I went to undergrad, Boston University, class of 2007. My major was human physiology. I, like every other good Asian student, was pre-med. I don't have any dentists in the family, but I have a bunch of doctors. My dad's a pharmacist. My brother is a doctor, my younger brother. So I had the intention of doing something in healthcare. I grew up like that. But medicine itself, like, going to medical school, it didn't really appeal to me. And so I was kind of just checking things out, navigating like all these, resources you get exposed to when you're in college. And it wasn't until probably my summer between junior and senior year that I did like a dental internship. It wasn't exactly, there was a research program at the medical school where they were researching centenarians and their dental records. So I was assigned to that. And that's when I first came across, I was like, all right, dentistry sounds kind of cool. So my senior year rolls around. I have no plans after graduation, zero plans, no job, no plans on going to graduate school. I didn't even know what the DATs were. So I was one of those free spirits that was just, going with the flow, much to my parents' dismay. Senior year, probably halfway through, I decided, okay, I'm going to take some time off and go to and figure out what I want to do and think about dental school. So after I graduated dentistry, I moved back home to New Jersey. That's where I'm originally from, and worked as a dental assistant. And I'm glad I did that. And I recommend everyone do that because, medicine, dentistry, all this stuff, you really don't have an idea until you get in there and see it. And on my first day of assisting this doctor, it was an emergency patient. She needed a tooth extracted. She broke her tooth. And he's like, okay, suction for me. I'm like, sure, it's suctioning, no big deal. I almost passed out. I was not expecting all that blood from a little tooth. And the doctor looks at me. He's like, are you going to be okay? I was like, yeah, I think so. I just, I wasn't prepared. So that year of working as a dental assistant was really eye-opening. And, I will say, becoming a dentist or picking any career like this where you're spending this much time and money in graduate school, it's a weighty decision, right? You don't want to just jump into it. At least for me, I wanted to be sure because essentially this is the rest of your life. With that being said, college was an amazing time, and I met most of my greatest relationships and friends there, and I did not have the best grades in probably organic chem. I wasn't focused. So I think that kind of was hindering me and like was a deterrent. I was not confident to apply. So I was debating between that and my master's in public health. So I decided to do this biomedical sciences program at UMDNJ, one, to boost my scores, to take more dental classes, and to really figure out what I wanted to do. And at that point, I kind of applied, didn't really take the DAT seriously. And I just kind of threw my application in. Naturally, I did not get in. And I think that was eye-opening for me because nobody ever talks about dentistry. Everyone's always talking about medicine and how hard it is and how the MCATs are. Dental school is intense. Dental school is hard, I think, if not harder than medical school. So, I really focused. I did very well at my master's, and I decided to apply one more time instead of doing my public health degree. And then I got in. I got into UMDNJ. It doesn't exist anymore. When I matriculated, it was called UMDNJ. Halfway through my school, my tenure there, it became Rutgers. So Rutgers absorbed it. I believe everyone knows what Rutgers is. So I was the first graduating class of Rutgers Dental School. Um, and so, yeah, that was kind of my winding, roundabout way of getting into applying to dental school. And I will say I was older at that time. So I was about 3 years out after undergrad. And I think, everyone is in such a rush. We live in a very fast-paced world right now to go from high school to college to grad school to work. My brother did that. He did that. Went straight to med school. And I appreciate the time off I had. I really do. Obviously, at the time, it was stressful for my parents. They're like, what are you going to do? It didn't matter. Those 3 years gave me some time to figure out what I really wanted. You're a little more mature. And by the time I started dental school, I was pretty serious about what I wanted to do and knew what I wanted to do. So, I recommend that for everyone, just to take a year off, because once dental school starts, it's intense. You are required to be in the pre-lab, in the clinic, in all of the lectures. It's not like, I went to dental school the same time my brother was going to med school. And I would joke with him. I'd always compare. He was never in lecture. He's never in class. He studied at home. Dentistry is hands-on, right? So you are spending hours in the clinic. You are spending, time not just studying all the material, but like holding a handpiece. You've never held a little drill before. You don't know what a class 1 prep is. Like, yeah, they make it sound like you drill into it too, but there's so much more than that. So it becomes your life, and you will make some of your best friends there. You will live and breathe dentistry. So yeah, it was intense. It was great. So I spent 4 years there. I knew from the beginning that I didn't want to specialize in anything. The nice thing about being a general dentist is you are able to do whatever you want. You can do ortho, you can do endo, you can do pediatrics. And I liked having that option. To this day, I like practicing a little bit of everything. Granted, there's things I don't like to do, like wisdom teeth extractions, not my forte, nor do I like it. But, I always have that option if I want to. So I didn't want to do a residency, a specialty, on top of which these specialties programs are 3-4 more years, and I think at that point, I just wanted to be done and start my life. Um, and during that time, I also happened to meet my now husband. So, life happened. And this is probably my big advice I give to students and people who come to shadow me all the time. Getting into dental school is just like the first step. You want to make sure you do well on the prerequisite courses. And I think it's okay to take some time off. Really, I do. You want to have a good game plan to study for the DATs. I have so many of my assistants to this day who want to become dentists, and or people who come to shadow. Granted, right now with COVID, nobody's shadowing me in person, but if you don't pick a date for those DATs, it's not gonna happen. You're just like kind of prolonging it. So have a good game plan. Don't wait too long to take the DATs if you know you're gonna apply this cycle or next, because let's say you don't do well, you're gonna probably want to have a chance to take it again. And that's okay. I took it twice. I can't remember what I got now, probably like 20, nothing amazing. And I got in. So you really, plan that out well. And I think at the time there was all these resources. It's probably dated now. There's probably so many DAT resources online for you to take and courses you could take. So take it. And dental assisting is a really awesome way to get exposure. I worked for a year as a dental assistant, and I think it really showed me what all the nuances are, what it entails. And yeah, it solidified my decision. So, think about all that. And also, dental school, you're so focused on getting in that I don't want people to forget about the fact that don't let it become the only part of your life. Have your life. I met my husband, I had a family, when after dental school, I did a year of GPR, which is general practice residency in New York. It's a requirement to get your license, and I was living in New Jersey at the time. And in New Jersey, at the time, it wasn't a requirement. It may be now, I don't know. But it was kind of an unspoken thing. Like you're not, you kind of want that on your resume when you look for jobs. So it was a natural thing to just go straight into a GPR program or AGD or a specialty. Probably only maybe 2 or 3 of my classmates went straight into private practice. So when I moved out to the Midwest, it's a different culture here. Almost all the doctors I've met here, they went straight from dental school to working. So I think it just depends, but I recommend doing that. That's when you get exposure to obviously more serious cases. You get practice on surgical cases, and you get to hone your craft in GPR under the shadow of all these doctors. So I recommend that because whatever hands-on training you get in dental school is limited. You have 3 hours for a patient. You don't get that in the real world. Um, and then you have to get multiple checks to get your prep checked and things like that. In the real world, it's hard. It's a hard adjustment. I feel like everything I learned in dental school, and at the time I learned amalgam preps. I don't think anyone's teaching that anymore. I'm not sure. And now it's all composites. I can't remember the last time I did amalgam. So it is an adjustment. Take your time, do a residency if you're interested and not sure. And that's okay. This is something you want to be good at, obviously. So take your time. So what is dentistry? In a nutshell, it is a field of medicine that focuses on the teeth and the oral cavity and basically everything head and neck, the bones, muscle, nerves, etc. But the thing with dentistry, it is medicine, it is healthcare, but we also are on the service side of the industry. So because of the way dentistry has evolved, a little bit separate than medicine, it is more service oriented, customer facing. Um, we have to also look at that part of it in the sense that our reputation matters. People will Google us. I can't remember the last time I Googled my physician, but for dentists, they're going to Google us left and right. So you really want to put your best foot forward, not only obviously clinically, but in terms of your bedside manner and your reputation. And I think the biggest thing when you're in dental school, you're focused on passing the boards and things like that. You don't really have any notion of the other aspect of dentistry, which is the business part of dentistry and owning a business or becoming an associate. They give you maybe one or two lectures. You have no idea. You don't know. You just, at the time for me, I assumed, I go get a job and I get paid a paycheck and that's it. No, it is a production-based system. You get a percentage of your collections. All that stuff was kind of eye-opening to me. And so I think, it's not like corporate jobs where you get a steady paycheck. It varies month to month, depending on how many patients you see and things like that. So that, it's important to know that. And I think now you guys, I see everything on social media. You guys are doing these shadowing programs. There's so many podcasts. There's so much information out there, which is amazing. I didn't think it wasn't as prevalent when I was there. So it's awesome that you guys are already up there and doing all this education and research, but definitely don't forget about the business aspect of it and the associateship part of it. Let's see what I like. So what kind of complaints do patients come in? Basically anything and everything. Broken teeth, jaw pain, cavities, missing teeth, misaligned teeth, tooth pain, headaches, TMJ issues. One time I had a patient come in and tell me they had a sunflower seed stuck in their mouth, like just very anything and everything. And you think, I think every day I've been practicing for almost 7, 8 years now. And I think I've seen it all. Nope. Every day there's something new. And the kind of amazing thing about dentistry, it's a pretty humbling career because every person is different. Every anatomy is different. Every tooth is different. So when you think you've known it and learned it, it's not true. Somebody will come in, a case will come in, and it will bring you down to earth and really show you that dentistry is super complicated and ever evolving. What kind of procedures do general dentists do? Fillings, bridges, crown work, root canals, ortho, Invisalign is big now, dentures, partials, implants, all this stuff, cosmetic procedure. Of these things, your bread and butter is probably going to be, especially when you first graduate, crown work, fillings, and extractions. When I first graduated, I worked in a low-income area office. It was, heavy public aid, and it was a lot of extractions, fillings, crown work, and some root canals. I did quite a few, and that's when I learned I didn't like doing root canals. I haven't done dentures and partials in over 5 years, but I did do a bunch when I graduated. So what I like to do now is mainly cosmetic procedures, Invisalign. Obviously, I have the fills, but that's really what I focus on. And I've learned over the years what I do want to do and don't want to do. I've eliminated all the things I don't want to do. I don't want to waste my time doing it anymore. I recommend to any of you guys to figure out what you like to do and just get better at that. Because when you try, in my opinion, to be good at everything, it gets overwhelming and exhausting. So, and this is what makes you happy. And you want to do dental work that makes you happy. So you will learn that as you go. And when you do, I think you will really succeed. Now, in terms of diagnostic instruments and tools we use, obviously radiographs, everything is digital now. I don't know if there's any offices that are. At the time when I was in school, we still did the traditional radiographs. We got a scanner my senior year, but now I imagine everything is digital. We do a lot of CBCTs in our office. I have a partner who he places implants. I don't, but we utilize that a lot, especially when we have patients coming with infections. You want to see where the infection is. You can even see all the canals on a molar with a CBCT if you're unsure of MB2 or where it is. Clinical exams is obviously very important. You're using your loupes, looking into the mouth and looking for caries, infections, fractures, etc. Extraoral exam is just as important because now, especially during the pandemic, the biggest chief complaint I'm seeing is jaw pain and sensitivity because everyone is clenching and grinding. So TMJ exam is a huge, huge thing. And some of these other things, endo ice is essentially a really cold pellet that you use to check if the patient is having issues with their tooth, like a nerve issue. So if you want to determine if it's going to be a root canal, tooth sleuth is a simple instrument that diagnoses fractures, things like that, that you can't see clinically or even radiographically. And my favorite new tool, it's not that new, is Xytero Scanner. The newest one, I couldn't get a video on, but the newest scanner it's an Invisalign product. It is not only great because it has eliminated, messy impressions. Patients hate impressions. I hated it. It makes you gag, tastes bad. This is perfect. Within 2 minutes, you can scan the whole mouth, and that you could send to Invisalign to get their trays printed. On top of which, the new one has a caries detector. So now you can see and show the patient the cavities in between their teeth, interproximal decay. And then the wear facets, it shows you where the patient is grinding and clenching. Let's say one, if it's a TMJ issue or grinding issue, or two, malocclusion. So if you have a recall patient, you scan them once, and then 6 months to a year later, you scan them again, and then you can compare how the teeth have worn down. And this tool is really useful in terms of closing treatment plans because pictures are the best thing. Videos are the best thing. When a patient sees their mouth on the TV, there's no question. When you sit there and talk about it and explain it with all these words like I'm doing now, it's hard for them to grasp that. But when they see it, it's a game changer. So this is a tool that we use frequently in the office, and it's literally changed the way we do dentistry, at least at our office, and the amount of treatment plans that we are able to close. From this scanner also, if you are doing crown work, the impression gets sent straight to the lab. It also cuts down the amount of time. And if it's a good, clean scan, the crowns fit perfectly because the lab has a perfect model off what to make it. So yeah, it's been really great. So my first case, I talk really fast, so you can tell me to slow down if I need me to. Most of my cases for Invisalign, I see mainly adults. And a lot of them have a history of ortho as a child. They're all relapse cases. Nobody wears their retainers, or they lost it, or whatever. So this is a young female patient in her 20s. She came to me. She's obviously unhappy with the anterior crowding, not very bad. And the majority of the cases that you guys are going to see is this. It's very simple. And the first thing you want to do, especially when you graduate, and if this is something you want to get become well versed in, is to learn the molar and canine relationship. Most of the patients out there who have a history of ortho are class 1 patients. So what that means, there's different angles classification of malocclusion. Class 1 is normal. The first molars where you look at, and the canines, you want them aligned perfectly. This is an ideal situation. Nobody's ideal, nobody's perfect, but this is what we strive for. This is what orthodontists strive for. A second majority of patients you're going to see is class 2. And that is what we call the overbite, where the front arch or teeth are forward and causing this cusp-to-cusp relationship in the molars. And over time, when you see patients like this and they don't get it corrected, those teeth wear down unevenly. And that is, with the scanner especially, you can show them the evidence of the wear, because over time, all this trauma causes, wear, bone loss, perio issues, things like that. So this is ideally not even just an aesthetic thing. You want to correct it for a functionality reason. And the rare cases that you're going to see is class 3, which is a severe underbite. The lower teeth and jaw is protruding outward compared to the upper teeth. And when you see this, you're not going to treat it. You're going to send this to the orthodontist, okay? This is a really tough thing. More often than not, it's a skeletal issue. And when you see an adult with this case, many times you can kind of flare the teeth in and correct it with braces, but this is if it's an adult and it's really severe, it requires orthognathic surgery, which means you're going to section the jaw, shift it all back, wire it up, and then do the ortho. So it's pretty involved, pretty intense, pretty painful. And a lot of my patients, I don't have that many that do have this. I refer them out. Invisalign's not going to treat this. So for the case that I showed previously, she started like this, and in probably less than 6 months, we finished her like this very nicely. I did not have to do IPR, which is interproximal reduction. Her crowding wasn't that bad. All I did essentially with the trays is widen out the teeth, widen the teeth and the jaw, and everything aligned perfectly. This is these photos are right when I took the tags off. You could see her number 8. She has a fracture there. So typically what I do after these cases, we do what we call finishing touches, where I would do some bonding and, enamelplasty to make everything nice. And then we put them in retainers. So for her, I did permanent retainers on the bottom, a lower lingual bar, and upper removable retainer. And yeah, this is, I believe now you guys get Invisalign in dental school. I'm not sure. I didn't. This is a CE course I took once I graduated. And I recommend, if there's something you're interested in, take all these CE courses. I know it's hard because you just graduated and we spent all this money on a degree, but these are the courses that are going to really, you're probably going to utilize in office and in practice. So Invisalign offers a bunch of them. Dr. Gala is one that I just took. It's a great course. So the second thing I wanted to show is another cosmetic procedure we do. It's called Resin infiltration system. This is to treat white spot lesions. Now, white spot lesions typically happen from ortho cases, kids who don't brush or floss well, they take off the brackets, you see the white spots. Sometimes it's a fluorosis issue, sometimes a genetic issue. But essentially, this is an adult patient in her 20s that you could see the white spots on her anterior teeth. In her case, it's a pretty large lesion that traditionally, before Icon existed, you had to either try to whiten, but when you whiten, it whitens everything. So it sometimes makes it more apparent. Or 2, the only way to treat this is to drill into the tube and put composite bonding. And for the most part, people don't want to do that. These are perfectly normal virgin teeth. Why drill into it if you don't want to? And the third thing is veneers. So now this system is great because this requires no drilling or bonding. What it does is a series of etching that you do on the teeth. You etch the teeth, dry it off a few times, and then you apply the resin. That gets absorbed into the white spots, and it diminishes the appearance of the white spot lesion, and it looks like natural teeth. So this is immediately after. It's a little dehydrated. She has that crown on the bottom that we also replaced. But you could see after 4 applications of this, of the Icon Resin infiltration system, the white spots have diminished. And this is really good in especially pediatric cases because their teeth are younger and they just pick up the infiltration really, really well. So this is something that I learned in residency and beyond. I don't know if they do it in school, but this is something that's really useful in patients like this a lot. The last thing I wanted to talk about is Botox. Botox is the fun new thing that dentists are allowed to do. Botox and filler, which is what I do, filler is mainly cosmetic, but for Botox, it's great for TMJ pain, for masseter issues. People are clenching and grinding all day, every day. And especially since the pandemic, people are cracking teeth and coming with so much jaw pain, myself included. And they don't want to wear a night guard. And for patients who are clenching throughout the day, you can't wear a night guard. You have to talk. You're on Zoom calls, you can't do it. So Botox is a great way to treat this. And if for those who don't know, Botox is a toxin, and essentially over time it paralyzes the muscle when on the edge, and over time it atrophies it. So when a case of grinding or clenching is the concern, this patient is overworking that muscle, causing a lot of pain and stress. Sometimes if you look at the patient dead on, you can see that one side of their jaw is larger than the other because they may be grinding or clenching on that side. So what we do is inject Botox into the masseter muscle. It is I do about 25 to 30 units per side, so 60 total. And you inject it. It's pretty quick. It's a 5-minute procedure. And you usually have them, depending on the severity of the situation, have them come on a 3-4 month recall. The thing with Botox in the masseter is it is not a covered, obviously, procedure. So it's an out-of-pocket procedure, so it's pricey. And patients usually expect an overnight result. But you have to realize that Botox or a masseter is a very large muscle. So it takes up to 6 weeks for it to really kick in. It's not like injecting Botox in the forehead, where these muscles and skin is thinner, that you'll see right away. This takes a little more time. But once the Botox is injected, the patients will find relief. Some patients find relief right away if they're having acute pain. The act of actually injecting into the muscle offers some relief. And over time, for patients who have really large masseters, you could see it shrink because the muscle is atrophying because it's not being overworked. So this is a really nice way to treat a lot of these patients. A lot of my patients come in, especially in the city downtown, they don't want to wear a night guard. They don't want to deal with an appliance. So this is something we offer them, and it's been giving us great results. And I know this works because I get it done myself and it's excellent. So, I tried to show cases that I figured a lot of, that were different, a little more cosmetically driven. The things I just showed you guys were things that I like to do, I prefer to do. Granted, I still do the crowns and fills, things like that, but a majority of my cases are Invisalign cases. I also do minimal ortho cases for young children when they have anterior cross bites and open bites. I was trying to find that. I'll try to find it in a bit, the photo. But that is also a course I took after graduation to learn how to put brackets and wires, excuse me, and use palatal expanders to treat kids at a young age. Because when you see these pediatric patients come in with their teeth in crossbite, they get locked in and it affects the way their jaw grows. So you want to intercept early as possible. And it's a really simple thing. It's really a matter of taking impressions, making the expander, but you have to know what to look for. And if you just see a child with 3-4-year-old malocclusion and you assume it's going to go away, it's probably not. So that is something I also recommend you guys take. So, in dental school, at least when I was there, a lot of my attendings, they were older. They were from the era of fee-for-service offices. Insurance companies really now, as I'm sure you guys know, have taken a good chunk of our production and what we make for these procedures. So the golden age of dentistry, what they were experiencing is passing us. So you really have to continue learning and innovating and putting yourself out there in order to be successful. Now, with the amount of debt you accrue in dental school and undergrad and whatever, it is important to think beyond that. And I will say that when I was in school, I didn't really think about that. I was so focused on just getting in and doing well that I didn't think about the bigger picture. And you guys are miles ahead of me. You guys are already doing all these shadowing programs and studying, but learning to be a business owner, if that is your goal, is really important. There are a bunch of podcasts that I listen to, and I'm sure you guys know Shared Practices is one. That's the only one that comes to mind right now, but there are so many that you can you should utilize and read. Dentaltown has so many resources. And as a dental student or even pre-dental student, I recommend you guys reading on there, hopping on the blogs, and just checking everything out because it's eye-opening. When you first graduate, you're going to become most likely an associate. Very few students or doctors go straight into business ownership because it's daunting, it's expensive. I didn't myself. I was associated for years, and now I finally became a partner at the current practice. And partnerships are tough. It's a marriage, essentially. You have to be really comfortable with the person you're working with because you're going to be with them forever. And it's not for everyone, but it was perfect for someone like me. I have a young family. I did not want the stress of being a solo practitioner. I love working with a team. It's always great to, bounce ideas off and learn new things. So that was what I wanted. So it worked for me, but it's not necessarily for everybody. So you really need to know yourself and do the research to figure out what you'd like to do. I think I said all this stuff because I have a tendency to repeat myself. So, the first 2 years of after graduating, you're going to spend your time just honing your craft and your skills. You're not going to be fast. You're going to be pretty slow. You had 3 hours to see, you'll have, one patient. You're going to have to see patients in 30 minutes. And I think I skipped it. I'll say my schedule. So in a normal day, these are our office hours. We're 8 to 8 every day except Fridays. We're 8 to 5. I work 6-hour shifts, either the morning or the evening. And Tuesdays I do an 8-hour shift, and Fridays. So I have one column of production. I have an overflow column where I see like crown deliveries or emergencies or tray deliveries. And then usually on my days, I have 2 hygienists. Our office is 7 ops, so it's fairly big. So we have the ability to, have that many patients at once. And while you're managing your production and overflow, you also have to do the hygiene checks. And the hygienists have about 45-minute recall patients, our new patients. So while you're, doing your procedure, you have to be able to hop over and do the exam. So speed is important. And it's annoying, I will say, that I'm telling you guys to focus on speed. But unfortunately, because of the way dentistry is evolving and insurance companies are, evolving, the more you see and the more you do in a day, the higher your production will be. And that's going to matter in the beginning. So the first 2 years, you're going to be slow, but just practice, 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 do as much as you can and slowly get faster. After that, after the first 2 years, you probably have a good sense of what you want to do and don't want to do in terms of what procedures. Root canals, I don't want to do them. I'm slow. They take so many hours. They're stressful. Not my thing. What I like to do is veneers and cosmetic cases. I like to see kids. I like to do ortho. And that's, where I focus my energy on. And that, my partner, he is a jack of all trades. He does everything. So he tells me everything. But I see how stressed he can get, like with all the procedures he does. And I just don't want that. I want a lot less stress in my life. Dentistry is very stressful. It's very taxing on your body. So the earlier you figure out what you want to do, great. I have friends who, after they worked for a few years, went back and did residency in pediatrics or ortho or whatever. And that's okay too, because you're not going to know. You're just not going to know after dental school what works. You're still figuring out your hand skills. You're still figuring out how to talk to patients. And so I think the main takeaway I want everyone to have is that it's okay if it takes a little longer. Don't listen to your parents. I know they're going to get stressed out. I took 3 years off to figure out that I wanted to do dentistry. I took a year after that to do a GPR, which not everyone does. And then, I moved to Chicago because my husband got a job out here. I had to start all over from scratch. I had my whole network. Everyone was gone. I didn't know anybody. Then I had a baby, so I only worked part-time. So, it took me a lot longer to get to where I am, but I'm so much happier where I am. I don't have the stress of a solo practitioner. I don't have a job where they force you to do certain procedures and produce X amount. You just do what you can and you do good dentistry. That is really, really important. That's all I have. I probably sped through this really fast. Dentistry is just, I don't even want to know how much it is now. It is a really, really big investment. So be sure about what you want to do. And I want you guys, I know COVID is cramping everyone's style, but shadowing is great to get some exposure in person if you can. But definitely, if you can, try to become a dental assistant. I don't know what the rules are in every state, but being a dental assistant was eye-opening. You learn how to take radiographs, you learn what procedures you do, you learn how an office flows every day, and you'll know if you want to do this or not. And just know your education doesn't stop. I am constantly spending thousands of dollars on CE courses, studying. I was in a Spear study club. I take all the Invisalign courses. This technology is advancing so much and changing so much. So basically, whatever I learned in dental school is like a foundation. But what I've really learned to practice as a doctor, I learned after dental school in an everyday life. And that's just it. That's just it. So the doctors that do well and succeed are the ones that are humble enough to know that they're not the best at everything. You are not going to be the best at everything because you're going to get a case one day that you're not going to know what to do. And that's the truth. So continue educating yourself, continue networking with the specialists in your area. We have a great relationship with the endodontists in our area, and they're huge resources, and we learn off of each other, and it's been great. And the last thing I want to say is I never did this, but you guys are good. Oh, you guys, social media and pictures is huge. I recommend you to start taking photos in school of your cases, even if they're not perfect. Take them on your iPhone, doesn't matter, because that is the way you're going to show patients or prospective patients what you can or can't do. And I wish I had a portfolio earlier on. I obviously learned this the hard way. Take photos of everything, put yourself out there on social media. Everything is out there now. I know you guys already know, but I recommend you do that. I follow kids who are on their pre-dental journeys. Do that, because that's how you're going to get, good exposure and patients. Because like I said, there's so much more business to it than the dental, and putting yourself out there is going to be the best way to do it. So yeah, does anyone have any questions?
That was fantastic. Thank you for that wonderful presentation. At this point, I'll go ahead and hand it off to our chat moderator so we can answer a few questions from our viewers. We have ample time, so I encourage our live attendees to
really fast.
No worries, no worries. It's a perfect opportunity for students to get their questions answered. So, Shalini, feel free to take it away.
Sure. Yeah, so we had a few questions for you. The first one was, how did you handle life / school balance in dental school? And did you survive off loans you had to take out?
So I'll tell you how I applied to dental school. Like I said, didn't do it right after undergrad. My parents were so upset. And for me, I knew, I went to Boston University undergrad. It's a very expensive school. I'm sure you guys know. And I knew dental school was expensive too. And at that point, my brother and I were both in grad school. My parents were like, you guys are on your own. So I knew I had to take out loans. I wanted to go to my state school. That was my number one choice because as an in-state student, the tuition is lower. I lived at home. I was an hour commute from my parents' house to Newark's campus, but I didn't want to spend the money on room and board because that's also killer. So my advice to you guys, obviously I was trying to get into dental school. I applied everywhere. The year I got a bunch of interviews, I actually got into BU dental school first. I was waitlisted at UMDNJ. I also got into Arizona. And then there was an interview for a school in California, but I decided not to go. I got tired. So, I would look at not just the tuition, but the cost of living. I was lucky that my parents lived close by to a really big school, so I was able to do that. And once, my parents moved me into BU, back to BU for dental school. They started way earlier than the other schools. And then a day before my white coat ceremony, I got a call from UMDNJ that I got off the wait list. And they're like, hey, do you want to come? And I was like, oh God, are you serious? Like, I just moved in. And my mom was like, yeah, just stay there. You're going to city. My dad was like, no way. You're coming home. You're saving the money. So I lost whatever deposit it was. Obviously, my departure got someone off the wait list at BU, so it all worked out. He happened to be from New Jersey as well. And I came home. And in terms of work life balance and dental school, it was hard. I'm not going to lie. When I mentioned that your classmates are, or your, like, they become the only people you see. It was a pretty small, I think, small school. You see them all the time. You eat with them all the time. You study with them all the time. So forging those friendships really helped me through school. And we all were there leaning on each other. You're gonna have some rough times. The commuting was hard for me, but I had a really supportive family. They really, like, my parents helped me out. They did whatever they could to make me comfortable. And at the time, I then met my now husband. So he was pretty understanding, because there would be months at a time where we had so much to study and so much to do that I wouldn't even see him. And he's like, it's cool. I totally get it. So I think if you're upfront and you explain to the people in your life that this is what dental school is, it's intense, they'll understand. And having a good support system is crucial to succeeding in dental school, not just from your classmates, but from whatever family, spouse, whatever you have. I got married in between my junior and senior year of dental school. I was older than my classmates, right? I took the years off. I never thought that I would, get married. I was like, they're all younger than me. I'm going to meet someone way later. But life is funny, and it just happened that way. So it was a lot for me personally. It was like you had to pass your boards. You had to go get married after a week after I got married, or back to senior year, back to clinic, you know. But you just take it a step at a time. And like I said, having that support system is important. That's really the only way you're going to get through dental school. And then, you get some breaks here and there, and you just go have fun with your classmates. We had dental school gala. We'd have mixers at bars and restaurants at the time. I would say take advantage of that. Be involved in all the clubs that you have in dental school, because that's really a way to relieve some of your stress and just to have fun.
That makes sense. The second question was, the second time around when you took the DAT, did you study on your own, or did you have any other resources to help you? And if so, what were they?
So okay, so the first time I took the DATs, I half-assed it. I just did. I didn't know what I was doing. And I had bought one of those books. I can't remember the name. Then there was an online CD that I bought. DAT Destroyer? Is that a thing? Do you guys know? Okay, so that's what I had bought. I did not take a course. And there was those flashcards you could buy too. Or was that boards? Regardless what it was, I bought everything on the internet that was DAT related, all the books, everything. And I literally locked myself in a room and studied my ass off. That's all I did. And I kept, like I mentioned before, I kept prolonging it because I wasn't booking a date, or I would change my date. And I think that's a big mistake, because there's only so much you can absorb information wise in 2-3 month period. After that, you hit a wall, you plateau. And so I think having that date in mind, let's say 2 months out, and just focusing for those 2 months towards that date, don't move that date. Take it. Just take it. There's only so much you can absorb. Half of the DAT is stamina, and how by the time you get to the math section, you're exhausted. The math was my poorest section because you're so tired by the end of it, right? So the longer you take to just even study and take that test, you're not doing yourself any good, in my opinion. Pick it 2 months out, don't change the date, and just study with everything you have and take it. You guys are coming right off of college, most of you. A lot of this stuff will probably be fresh in your mind. I took 3 years off, so it was a little harder. I didn't remember Orgo and all that stuff. So I really use those DAT Destroyer and all those little shortcut things they have online I had the time I had a CD that would have the exams, and I would just keep taking the exams over and over again, because for me, I realized my issue was stamina. I was so tired by the end of it that I just was like clicking stuff, you know? So that would be my recommendation. I wish I had some magic thing that I did, but honestly, I just focused and just did it. So yeah, that's what I did.
Yeah, the math section was definitely not my best either.
Awful. It is like what is it? Still 45 questions for 40 minutes, right?
Yeah, I did it like 3 months ago and I just completely forgot about it.
I know. The English section was my best section. That was like easy to me. The math was awful. And it's all about stamina. I think they do that on purpose, because when you're in school and when you're doing your pre-clinic, like those the lab tests, God, I can't remember the thing. It's a time constraint, right? And you're like stressing out. You didn't sleep the night before, and you have to do the procedure in X amount of time, even for boards. Now I heard you guys don't have patient boards. It's insane to me, because that was probably the hardest test of my life. Right now it's going to be all on mannequins, correct? Did you guys hear that?
Yeah, I've heard that as well.
You guys are so lucky, because that was a whole stress in itself to even know if your patient's going to show up and if the lesion you picked is the perfect lesion for it. I had classmates that were told their patient wasn't a good candidate. It was a mess. But yeah, that time, I think they do that on purpose, because in dental school it's all about timing and finishing on a certain amount of time. But yeah, I would just say stick to it, and don't feel bad if you have to take it twice. Just take it twice. I mean, yeah, you're spending the money, but if you did poorly the first time, it's okay. Just take it again. You will do better. You'll know. And so when I applied, they saw both of my scores and they saw that I improved. And they're like, okay, cool. They did comment about my math though, but they still accepted me. So I think they're going to look at the overall package. I wouldn't worry too much.
Were you certified when you became a dental assistant, or were you in
I was not. I believe in New Jersey at the time you had to be certified to take x-rays. None of my bosses wanted to pay for that, probably because they got me as a cheap dental assistant. So I was okay with that. They had another assistant take the x-rays. I suction. I got to see the procedures. I wasn't a shadow because I was an employee. So I actually got to get in there. I have a shadow right now. She can't really do much, and it's COVID, so it's different. But yeah, I got to see the nitty gritty, and I learned a lot like that. So I was not certified. And I think this varies state by state. Like in Illinois, I don't believe we have that, but don't quote me on that.
Yeah, I've heard it varies.
I mean, if this is something somebody wants to do, I just applied at every, I don't know what it was, like Craigslist or something at the time, whatever dental assistant jobs there were, I just applied, and you never know. And I told the doctors, I was like, my intent is to go to dental school. This is why I'm here. And a lot of them, everyone was really receptive. They're really nice and understanding, and they would take me under their wing and teach me whatever they could. So I think it's a great way to learn about dentistry, especially if you're taking some time off or if you're on the fence. Because I did have one or two classmates start first year of dental school and they dropped out because they didn't like it. And to me, that hurts because it's a lot of money, So that's why I say take a year off, because going straight from high school to college to grad school, it's a lot. It's a lot. And you guys are young. You need time to figure it out.
Along the same lines, how do you advise us to reach out to offices to work as an uncertified dental assistant or intern?
I know for our office, we might be on some list with one of the schools here, but honestly, we have people cold call us. They just like Google us, maybe where they live, or maybe they Google our reviews. I have no idea. And they just cold call us and be like, hey, or email us. They're like, hey, are you open to having a shadow? I'm interested in going dental school. And I want to say 95% of the time, whoever you call, especially if it's an office like ours, they're going to say yes. They come in on this time. Sure, check it out. And a lot of our staff, one of them is becoming a dentist. He's in dental school now. He's an assistant. Another one, she became a hygienist. So we are open to that. So I would just cold call if you can't find it, or see if in the if through the school, there's a listing of offices that allow shadows.
Cool. Another student asks if you have any dental interview tips.
Oh gosh, this is like so long ago now for me. Dental interview tips. I will say this, make sure you guys still have to wear suits, right? Make sure your suit looks good. There were a few, and attendings told me these stories afterwards that they didn't look professional. They didn't have their files. Like, you need to look put together. Have your stuff. Have your application printed out, ready to go. Because one of the interviews I went on, he didn't even have the paper in front of me. I had to give it to him. So it obviously made him look bad, but you make sure you have from your end everything together. Now, in terms of the interview itself, I practiced with my brother and my parents probably. You know, you're going to get the standard questions like, why do you want to become a dentist? Why do you want to come to this school? Have an answer. Do your research. Look up those schools you're applying to. Make sure you Google everything about them and know everything about them and have an answer, prepare for that. Obviously, don't sound rehearsed, but don't also not have an answer. And also have a bunch of questions for them, because that shows the interviewer that you are smart and, you know, and inquisitive, and also kind of interviewing them, that you're like, you know, I'm a candidate, but I'm also curious to know what your school has to offer me. You know, some schools are strong in the research, some schools are stronger in the clinical, and you kind of want to know that. You know, some BU had a great international program. They would do something abroad. I didn't really care for that. UMDNJ, or Rutgers now, was pretty strong clinically. Our requirements at the time were really high for X amount of units of dentures, et cetera, that need to be completed. It was pretty rigorous. So know about if you are considering specialty, ask about their, specialty programs. Schools that have ortho residents and OS residents and things like that, just know that they take a lot of your patients. So if there's an endo program already at your office or school, those residents are going to get first dibs on the root canals. You're going to get the second tier. So, but it also offers you a place to go check it out in shadow. So know the schools inside out. Have those basic questions prepared, and make sure you do your research on the school. Don't give them a generic answer. They'll read through it. In your personal statement, make sure you remember your personal statement. Review your application right before you go onto the interview, because you're going to do that application like forever ago, and then it'll be months pass, you'll be stressed, and then you get calls for interviews, right? And they'll pick some random thing like, oh, I saw in this time you were a Girl Scout. Well, tell me about that. Just make sure you remember you put that stuff down, okay? And I think the biggest thing people see, like, by the time you get to the interview stage, you've already went through the first pass. Your grades are good enough. Your DATs are good enough. You already got through that. They want to see what you're like as a person. They want to make sure you're a confident person, a caring person. You have good bedside manner. You know, you're going to be a dentist treating not teeth, you're treating people. And they want someone that's going to, one, meld with the culture, and two, be able to handle the stress and become a good clinician. Because if that's where they're screening you and weeding out those people that they don't think is going to be a good fit. So I think practicing interviewing with a friend or a sibling or a parent is a good way to gain some confidence. Have some confidence in yourself, but obviously don't be arrogant about it. They can read through that too. So practice, practice, practice. Don't write anything down. They don't want anything rehearsed. But once you practice, you know what to say.
That makes sense. Someone asked, would you recommend commuting if you're within an hour distance, or looking back, would you have not commuted?
I probably still would have. To me, financially, saving all that money was huge. And I'm so glad I did. I came out with a lot less loans than some of my classmates. I don't have any loans anymore, which is great. I was lucky my parents helped pay for my undergrad for my brother and I. For grad school, it was all us. And I didn't have much. So probably I'd still commute. I spent you're going to spend the whole day on campus. So it's like 8 in the morning till 8 at night. You're basically living there. And so in terms of traffic, at least in New Jersey, that wasn't an issue. Yeah, I was tired. There have been times where I was tired and I would just crash with a friend, or my brother, he was on campus. But no, I'd probably still do it again. Like, to me, I feel so good now not having that student loan burden, to be honest. And that allowed me to spend more money on these partnerships and practices and things like that. And then obviously I had a family, we bought a house. Like I know student loans are good loans, but to me personally, I wanted to minimize that as much as I could. And that to me was paramount. So no, I'd probably still do it.
This next question, I think, was one about the different classes of malocclusions you were talking about. They were asking about an open bite, and if you could talk about that.
So an open bite, anterior open bite, is caused by thumb sucking, tongue thrusting, and they also are malocclusion, so they could be class 1, class 2, but that's what you're looking at. The anterior bite is open, and you want to close that up. Typically in that case, you're going to do braces and kind of retract things in. When you see that at a young age, that's when you kind of want to intercept. And that goes back into the conversation about the limited ortho that I do. I do put brackets on. I just did one on my niece to fix her crossbite. We do expanders with not expanders, appliances that prevent the tongue from coming up forward and thrusting to help close that bite. Because if it's intercepted at a young age, it can resolve on its own. But as an adult, I have a patient that I'm currently treating through Invisalign. Invisalign's pretty good about the open bite treatment. You can fix it. She has a history of ortho, and she has an open bite because she is a tongue thruster. So the first thing you want to teach these patients, these adult patients, is that, yeah, I can do all your ortho and everything, but it's going to regress back to what it was if you don't correct that. And sometimes it's not so much a tongue thrusting, it's just like the way they're speaking and their tongue goes to that side. So you tell them to take a mint, put it to the roof of their mouth, and hold it there to learn to teach your tongue to stay there. And if that isn't enough, sometimes I tell them to go to a speech pathologist to retrain the tongue before we start ortho treatment, because inevitably it will relapse if you don't correct that. And that's about it in a nutshell for anterior open bite cases. There's so many more details to, like, per the classifications. There's Div 1, there's all this other stuff that you guys will learn about in school. You don't need to worry about now, but know that it's just more than, in an adult at least, it's more than just doing the ortho. It's about teaching the tongue where to go. Because your adult patients are not sucking their fingers. It's a tongue issue.
Yeah, it's really interesting. I didn't think about it that way.
I'm gonna see. Let me see if I can find my niece's pictures. You guys will probably like it. I was supposed to upload it, but my daughter. I can still answer your questions in the meantime.
I think we might have time for just like one more question.
Sure.
They asked what's the difference between MS and class 1 ortho?
MS. Wait, what's MS?
I'm not exactly sure what they meant by that.
But what's the difference between MS and a class 1 ortho?
Yeah.
Did they mean the angles classification?
I'm
not sure.
Not entirely sure. I'm so sorry. But we had another question. Would becoming a dental receptionist be a good way to get dental experience?
That's a good way to get experience on the business aspect of it. I still think you want to be clinical, because that's the best way to, I can't find her picture. That's the best way to get the clinical exposure. In terms of working the front desk, yeah, you're definitely going to get the patient-facing side and the insurance side of it. That, I will be honest, I still don't know fully to this day. I do rely a lot on my office manager. So yes and no. I don't think it's a bad thing, but I still think being an assistant is key because you're like helping treat patients. So that's going to be the game changer. Oh, it's 6 o'clock already.
I'll go ahead and jump in here. That was fantastic. Thank you, Doctor, for an awesome session and for connecting with us.
Photos. I really want to
no
show you
worries.
that braces case, but I can't find it. Organize your photos, guys. Keep it in folders. Don't do what I do and keep it all on my phone. Okay.
But yeah, we'll go ahead and conclude today's session on that note. And we'd like to wish you a productive year. Thank you again.